First and foremost, it's going to be a great pleasure and honour to be moderating this town hall with the keynote speaker, Alex Kailash, who is a great friend and colleague. I did want to make just some opening remarks. First of all, it's really important to acknowledge that over 200,000 people today have died of COVID. And the family and friends are experiencing unfathomable pain, as are many members of society. So while we keep looking at the number of cases, you know, the lives of many family have really been devastated, and they will remain distressed for many days, weeks and months. Also, I want to acknowledge the frontline workers. And yes, it's all the healthcare professionals, but it's more than that in my mind. It's volunteers, it's families, it's those that are advocating, it's those that are standing up for the rights of older people on a moment-to-moment basis. And it's everyone on this call, really, because you are frontline in your interest and the way that you can influence policy at a grassroots level. And finally, I want to acknowledge colleagues and friends at the United Nations and WHO. You know, many of us will say they're not doing enough, but believe me, they're working intensely, almost minute by minute during the day. And so they're responding to gaps, they're refining guidelines, and they're supporting, you know, and influencing member states. So it's a collective global attention to the pandemic. COVID-19 is a global crisis of the sort that this world has never experienced in my generation and probably future generations. No healthcare system in the world has surge capacity to cope with the influx of tens of thousands of people. And what I've understood in the weeks that we've been in lockdown is even the most sophisticated systems are not coping with the testing, the isolating and the tracing. So if the most sophisticated systems in the world are not coping, what is really happening in developing countries who have far weaker systems? But also we must remember that older people and those most vulnerable, you know, have courage and resilience. And so it's really, you know, coming back to the conversation of all older people are not the same. You know, they're not a homogeneous group. So on that note, it's now my great pleasure to introduce Dr. Alex Kailash. Now, many and most of you know Alex, but I took some time to actually look at his bio last night. So I'm just going to touch on a few things because, you know, Alex is one of those people inspiring. His enthusiasm is contagious, and if you've ever been caught up in Alex's whirlpool, you'll actually know what I'm talking about. It's unavoidable to be enthusiastic, passionate and committed after you've met Alex. He's a medical epidemiologist and specialised in the study of ageing. And he's since 2012 president of the International Longevity Centre in Brazil. And he was co-president, you know, since 2015 to about 2018. He was formerly the director of WHO Global Aging Program in Geneva, and this followed an academic career largely at universities in London and Oxford. You know, Kalache or Alex or my friend has researched and expanded his enthusiasm and commitment, which is always evidence-based.
In einem Webinar, kann ich dich übers Wochenende erreichen?
Yeah. Could I ask everybody to put their phones on mute? That would thank you.
One on Sunday.
Okay. All right. Just two more things that I want to share, Alex. You're listed as in the 100 most influential Brazilians, but could I suggest that your influence, you know, touches many nations around the world, and you have emeritus positions in many of those countries. Your lifetime achievement, I think, you know, is not based in your epidemiology or, you know, the university positions that you've got. Your lifetime achievement is to be able to bridge across disciplines and sectors, you know, and bring together a global movement that focuses on the rights of older people. And one final comment, and I didn't know this, you know, you're a pianist and chef. And that's the human being that I know and I love. Alex, it's our great pleasure to have you opening this town hall this morning, and please take it away.
Thank you so much, my dear friend Jane. I'm really touched. Thank you. It's flattering, first of all, to be introduced by such a great friend. Good morning to you all. Good afternoon, good evening. It's great to see this screen with lots of names, people that I have known throughout my journey on aging. It's actually 45 years that I have been dedicated, focused, passionately about aging. But forget about my academic credentials. Forget that I have been director of WHO and I have been this or that. That's not material at all. That's not important at all. I'm here because I'm old. And this is what matters, that I'm here to speak on behalf of the voices of developing country people, where most older people, because we have already seen what is happening in the developed world, and we have to take notice of what is happening there so that we can somehow get prepared to this infringement of rights. The neglect of older people that has been exposed so pathetically, the ageism that has never been shown its ugly face in such a violent way as the COVID has done. Yet we are not disposable. And yet we are not going to let them do what they want, whoever they are. Our president, Bolsonaro, has referring to the pandemics. Well, it's a little flu. Some people will die. They are old. What does it matter? So what? He forgets to think that he is himself 65. Older people is always somebody else there. They don't introject them. They don't reflect that they are also old, and so many of the authorities that we have around the world overseeing the abuse of older people in this unprecedented level. They don't think about it. They have no capacity to introspect or at least to show some empathy. Jane, you invited me and gave the privilege to, at the last IFA conference, give the keynote on inequity, inequalities. And what we are talking about here is so much about inequalities. How could we accept that the richest city in the world, in New York, we have been seeing and witnessing the barbarity that is happening there? A city that has more billionaires by square mile than whole continents put together. And yet thousands and thousands of people dying because they are considered and treated as disposable. And we have to call attention that there, like elsewhere, in Italy, in France, in Spain, in the UK, etc., it's always the inequity that calls attention. The immigrant population, the Black, the indigenous, the people that have had a long life of neglect, victimized by inequality, and now at the end of their lives, they find death at that appalling circumstance. How could we accept that the United States, that spends 19% of its gigantic wealth, 19% on health, $10,000 per capita, and yet leaves so many millions behind? Look at what has happened in France, in Italy, in Spain. Poor brown people, immigrants, Latinos, disposable people. How can we look at Britain and see that the Prime Minister, after recovering from God, from COVID, thanks to the national health system, the same national health system that his party was doing its best to weaken. Now he thinks that it is a great national health system. But why didn't you think about that? Years and years of corroding what is so precious. But I should take time here to reflect on one thing, which is a very positive message. Out of any crisis, we can also build something meaningful. If it were not for the horrors of the Second World War, there wouldn't be political consensus in Britain to create the national health system that has then inspired other countries throughout the world to have similar systems, something that the United States lacks. Now, the Prime Minister in Britain may be more committed to strengthen something that has saved his life. But it's not saving the lives of many that will meet beds that are occupied. And then we have Sophia's choice in one of the richest countries in the world. How can we accept the horrors of stories that we keep hearing? What is happening in residential care facilities in North America, in Canada, in Europe, in Spain? Residential care units that will be filled with corpses, cadavers, or people still alive, and the staff abandon them. That's not the norm, because if there are heroes in this story, we have to be reminded that it's the dedication of healthcare professionals and carers, and I'll come back to this point. If all this is not gloomy, it pales when you think about what is about to happen in developing countries. Story is the same, inequality, that will make the most important victims. But in developing countries, the face of COVID, of these pandemics, will be different. First of all, it will be younger, because we have millions and millions of people in this country alone, in Brazil. We think we have accounted for 50 million people before they reach the age of 60 who have comorbidities, diabetes, cardiovascular diseases, hypertension, respiratory diseases, not by their choices, but because of the social determinants of health. They are the victims. And we will, in the lack of a better word, rejuvenate the epidemics. There will be more victims that are far younger, and already now in Brazil, 25% of deaths are in people that are far from 60. Not only younger, the face of the pandemics in our countries will be darker, much darker. It is the structural races, the Latinos, the Black population, the mixed people, the immigrants. Again, they will be the first to die. Inequalities again. And the face will be poorer, much poorer. We have just heard that in Brazil, an extra 7 million people have come below, not poverty line, misery line. Altogether, 15 million people don't have enough to think, what am I going to eat tonight? Wash your hands, but we don't have water at home. Wash your hands, but we cannot buy soap. It is basic as that. And their bosses, in the comfort of their apartments and homes, are telling them, go to work, go, break this silly social isolation. We need you to work because we need profits in our pockets. It's very easy to say that. And we are seeing day after day, it's not only in Brazil, but just illustrating with my country, policies that are just feeding into inequality. Right at the beginning, of the pandemics here in Brazil, still in March, what we heard is that you need to have a flu shot. 2 or 3 days of driving through so that the middle classes could get their flu shots in the comfort of their private cars. They didn't have to expose themselves to any risk. 2 or 3 days later, the total number of vaccines available had finished. And then you had crowds of ordinary people at the door of health centers trying to get the flu shot, but not finding it. 2 days ago, they start finally testing in a meaningful way because we didn't have access to testing in any big numbers. Where did it start? In Brasilia, the capital, not in the suburbs, not in the poor districts, but at the heart of the power of this country, through driving through. The middle classes, the elite tested. The rest of the population, we have no idea. We just know that there is tremendous subestimation that the number of deaths is far bigger than what they are saying. Disposable. They go undetected. The number of deaths that we cannot even count. And then hospitals that are unprepared. We have 6 capitals in Brazil, including São Paulo and Rio, that have already reached collapse in the hospital sector. We don't have intensive care units anymore. And of course, the poor will find it far more difficult to be treated than the others. And the face is not only younger and darker and poorer, more unequal, it's also more female. It's more female because so far, you women will be working in substandard conditions as auxiliary nurses, unprotected without the proper gear so that you can protect yourselves. We have seen this in Italy, in Spain, in France, that far many more women died in the health professions than doctors. We already seen this here, carers, that in spite of everything, will continue to be committed. Also more female, because the long-term consequences of COVID that will bring more inequity will be devastating for women who perform most of the informal sector. 75% of workers in the informal sector in our country, in Brazil, are women. But how to confront this? We need a global call to strengthen international cooperation. I'm glad, Jane, that you start this your introductory remarks, reminding us that the international organizations are crucial. And yet what did Mr. Trump did? Cut its contribution to WHO. It's absurd, it's egocentric, it's individualistic. I dare even to say that it is psychopathic behavior that is unacceptable. Acts of piracy. We in Brazil had the governors of the poorest states in the country from the Northeast. They combined their resources, precious resources, to send cargo planes to go to South Korea, to China, to bring equipment. But these cargo planes had to stop over in Florida. And the authorities there looked at, what are you taking there to Brazil? We'll stay here. We'll pay twice as much cash, and confiscated what we had brought. Is this the kind of global cooperation that we need to confront any crisis, let alone these pandemics? It's tough. It's tough that it's not only that our, again, quote unquote, ordinary people are disposable. If they die, so what? Their bosses will have an army of people that will be desperate to fill the vacant jobs. We needed to form a coalition and I know, Jane, that you agree entirely, that will go well beyond our immediate constituencies. This is far bigger than older people alone. I think that we have to reach out to civil society organizations that deal with women's rights, human rights, immigrants' rights, LGBTI rights, disabled people rights, Black and indigenous people's rights. I'm talking about rights. We, above all, are citizens, and we demand to have our rights respected. But if we form this coalition, we'll be much stronger than speaking on the voices and representing only our immediate, of course, important. We are the main victims. But we have to go back to inequalities, human rights, and protect the precarious work of so many hundreds of millions of people that will suffer the economic consequences. I just want to finish these remarks by reminding you of Martin Luther King's, one of his quotes. The greatest tragedy in a period of social transition is the silence of the good, not the stringent clamor of bad people. Bad people will shout, but if we would remain silent, we may come to regret, like the Germans did in the 30s, when they kept silent, when they should be fighting against the horrors that would come. Perhaps they would have prevented that. But Martin Luther King also said, oppressed people cannot remain oppressed forever. The yearning for freedom eventually manifests itself. After this pandemic, perhaps, and I do hope that mantra, which I find sinister, that came and invaded the culture throughout the world, emanating from the Silicon Valley. Move fast and break things. Perhaps we'll replace it by move more calmly and fix things around you. There is a lot to be fixed. Thank you.
Thank you very much, Alex. That was a powerful oration about what is really happening at the coalface. So thank you for that. There are lots of questions, so I'm going to see if I can bundle some of them. And forgive me if I mess people's names up. We do have a couple of questions about, the government pledges. And I'm conscious that our Premier came out and admitted on television that the long-term care system was broken. Well, thank you for sharing that. Many of us knew that. Many of us knew that, and we've known it for decades. But there's a couple of questions about how do we actually ensure that the pledges that our governments are making are actually actioned, actually happen. So that's one question to have a think about. Just a comment from Anna in Portugal. She says that much more women are dying in Portugal, as you've said. I also want to pick up on Tendai Emmanuel. Tendai, I'm going to ask you to ask Alex the question. So would you like to ask, you're from Zimbabwe, so could you ask Alex the question? Okay, well, what about if I read it? So Alex, in Zimbabwe, 2 of the 4 recorded deaths attributed to COVID have been older people over 70. Both have no history travelling. Our fear is that inadequate resources are available to carry out wider testing. On the other hand, there is a growing narrative that suggests that the COVID path through Africa is going to be different. Is there any evidence to support that? So the question about government pledges, and then this question about is there any evidence that the pathway of COVID in Africa is going to be any different?
Thank you, Jane. I think my mute came off rather late there.
Oh, okay. Sorry, Tendo. Did you want to add anything to that?
No, it's just this growing narrative in Africa that we're not seeing the numbers that we've seen in the West. And so is the pathway for COVID-19, for this virus, different for us? Or is it that we are not testing enough? And if we're not testing enough, perhaps our government shouldn't be focusing resources in other areas and focus in testing so we can really catch it. We're really trying to find our way forward. I know I'm part of quite a few groups in Zimbabwe, and we're just sort of in the dark in terms of what does this mean in terms of safeguarding our local communities, especially older people.
Okay, thanks, Tendo. Alex?
Tendai, let me start with your question. Thank you so much, and hi, Zimbabwe. We share the same predicament. The countries that can produce and export these tests, vaccines, uniforms, gears, protected gears, even simple things like masks, let alone respirators, they want to fetch the highest price in the market. They are not interested to sell to us. And as I have said, when we manage to buy, they confiscate. So we are in the dark. It's the same Tendai in Brazil. As I said, the little tests that we managed to have were directed to testing middle class. So we may end up knowing that 10% of the population that would be well off, we may know what the rates of infections are. But look at the favelas behind me. I live in Rio, the city that has appalling levels of inequality. We know nothing that is happening there. In Manaus, which is the capital of the Amazon state, I can tell you that one single figure shows a lot. In equivalent months of March and now April, there would be an average of 25 people dead every month that the cemeteries would have to burn. We have seen this escalating to 140, 150, 6, 7 times more. And then the government says, no, we can only act if we have the empirical evidence and the tests. The tests they know that they cannot get. And when they get, they will test middle class people like them, like the minister. And in the same speech, he says that, but Brazil is faring much better. We have much better data compared to other countries. But you have just said that we don't know, that we don't have the capacity to test. So how can you make a statement that is so contradictory in the very same speech within 3 minutes? So it will be tough because we will need to act to a large degree with the uncertainty. We have to assume, Tendai, that the situation for us is as bad, if not worse. And as I said, don't expect that these deaths will be after 60, 65, 70, because you know, like I do, that in our countries, comorbidities start far earlier, and people were 40, 50, because they had very tough lives. They couldn't have a health promotion, good diets, and going to a gym to get strong. So we know all this.
Alex, I just want to pop in a comment here.
Yeah.
I think in some developed countries also, testing is not available. There's been problems with, the active agent. We know in some countries that, the deaths of older people in nursing homes are not being recorded. I mean, that's been made public. We know that, some deaths will be recorded as pneumonia, but because the testing, so I think that this is, I wouldn't say a global problem, but it is an issue. I guess I come back to the why, the why. Now, we've known this pandemic is coming. Pandemic planning has been relatively poor in some countries, so that's my thoughts. I do want to come back to this issue of how do we hold the feet of government to the fire? because what's said in public settings at times of acute stress is 20 million here and 1 billion there and etc. But so how do you really hold the feet to the fire? Because as would you suggest that we use COVID-19 as a case for advocating for a convention on the rights of older people? So
Eventually,
go on.
Eventually, I think that, out of a crisis, reminding you all that in Chinese language, crisis and opportunity is the same word. And I think that the opportunity that we should seize is to strengthen our case for a convention on the rights of older people. I have no doubt that we'll come out if we act together well, and if we establish the right links, stronger links with women's movements, indigenous people, minorities, and all the groups that are considered to be disposable and are being subject to so much inequality, we will come much stronger than we were. You all know that we have been struggling for 10 years to have the convention discussed seriously at UN level, but systematically developed countries have closed ranks and saying, no, we don't need. We have all the legal frames there. It's a question of implementing them. And that, Jane, is just to comment on your comment. Of course, we know that you are doing wrongly in developed countries. We should learn from the lessons. We have seen what has happened in your residential care and that you are not testing enough people. But the focus of our discussion today is developing countries, emerging countries, far much poorer. This is why I'm passionate about, bringing this voice and focus on developing countries without ignoring that it is unacceptable what has already happened in Europe, it's happening in Canada, and is happening in the United States. So it's really to bring the focus again. And there was that first question about long-term care. We knew that they were not regulated, they were understaffed, that their employees, most, and again I repeat, women working and subjected to appalling working practices, and yet expected to give the love and care to these older people that their families could not or didn't want to provide. We have known this forever, for years. In my days at WHO, we kept seeing the examples and denouncing. Maybe also from this big crisis, the pandemics, we will have a voice to speak on behalf of, it's not trivial, up to 6% in some developed countries, older people live in institutional care. It's far lower in developing countries, not because there is no need, but there is no funding to provide a decent roof on top of their heads and food on their table.
Yeah, I guess the question comes back to, and I'll give you two, how do we hold the feet to the fire? Right, that's one thing. And also, Peter Whitehouse, welcome Peter. What are the critical factors that will influence whether neoliberalism or democracy wins the COVID war?
I'm glad that you have difficulty to say the word because it is as ugly as it is to pronounce. And it is this imposition of neoliberal thinking that has corroded our social fabric. I don't know the answer. I just hope that out of this crisis, there will be what I described before. Don't move so fast and break things. Let us think about the empathy. Let us think about how to fix things and walk more calmly. Don't start again thinking about your gigantic profits. Don't feed into the inequality that we have seen over the last 2-3 decades. that's horrendous. And I'm talking about inequality within countries, but also inequality when you compare countries. Let us hope that the World Trade Organization will finally impose a say from the producers of commodities so that they can also have a say about the prices that will be fetched for what they're doing. But they don't know. It's very early days. We are already seeing the oil companies and oil producer countries, wrecking through fixing prices, interest again in protecting the immediate interests. Neoliberal thinking that has dominated and unfortunately continued to prevail in so many countries has established very deep roots. And our duty is to continue to denounce and to form a stronger coalition to feel stronger to confront it.
So, one of your mantras over many years, Alex, has been intergenerational solidarity. Could you speak to that in the context of low and middle income countries? Because, our work, in India, really reflected, a community movement. And I acknowledge our colleagues from Help Age International on the line, as well as the IFA UN representatives. Could you speak to intergenerational solidarity? And thanks, Kathleen, for the question.
As you said, Jane, this has been intrinsic in all the work that I do. I think that we, older people, have a very special role in cementing the intergenerational cohesion. We are no longer, by and large, interested in competing. We have or not already had a career. We are interested to leave a legacy, to be reminded by something meaningful, to have a purpose, to bring together a generation that will have more hope than what we have enjoyed through our much longer lives. I look at you, Tendai, again, and I think of the terrific example that we have from Zimbabwe, where through the devotion and vision of one of the 12 psychiatrists in Zimbabwe. Yes, in Zimbabwe we have only 12 psychiatrists. But this guy, who's not particularly old, but what he did was to train grandmothers so that they would be the practitioners that would calm, that would bring peace to younger people desperate for whatever reason. Patients that wouldn't find a psychiatrist, a specialist care. These grandmothers are those that are really fulfilling that need and bringing hope to those younger generations. That they have done throughout Africa, looking after the orphans of AIDS. Tremendous work that Help Age International does. And I am very proud to be in the very first meeting of the board of Help Age International in 1983, and to have continued to work with them solidly throughout these 30 years. Just yesterday, I was on a call with Justin, the CEO, because I believe that the focus on intergeneration is so important. We have to reach out to save the children. We are on the same boat. It is in the interest of younger people that we continue to have a voice and a life. Because I tell you, my mother is 102 and needs care. And every single time that I need inspiration to carry on with my work, as Louise Plouffe, for instance, knows well, she has met my mother, it is there that I get the inspiration. It is with my mother, looking at what she has done throughout her life, that I have the juice, the fuel to carry on. And I love her as much today when she needs care and devotion because she's frail, as I have throughout her life, perhaps more, because she needs me. And I know that if she could express, she no longer does with Alzheimer, she would say the same. You are old now, my son, but I love you as much. As I hope and know that my children love me now that I'm 74, in the same way that they used to when I was so much younger, and so they were. So this intergenerational exchange, this fabric that we have to bring together, COVID is a challenge that perhaps will remind us that every single generation has a role to play, and a very important role that is.
So Alex, we've got about 10 minutes to go, and the last question I'm going to come back to is, how do we hold the government's feet to the fire? But there is this very interesting point that Raymond is making from Geneva. And I want to take the first part of it because it speaks to the media and the way that media are portraying COVID and older people, and I want to turn it upside down and say, and the sentence reads, public television on COVID, they often present the number of dead, e.g. 45% were people 65 and over, alluding to the higher risk that older people have. But they do not mention who are the 55% majority people who die who are younger than 65. So that's a question in itself around, you know, how media are reporting, you know, numbers and people. But I want to ask you about, how do you call media on, you know, their lack of evidence, and sometimes, you know, a little information, a person is seeing themselves as the expert. So you've had a lot of experience with media. So what, can you just give us some tips as to how you actually address media? And then we'll go on to the last question.
Well, the very first thing that I do, Jane, is always show this. I am here, I am old, I'm not a specialist. I'm here because we have a voice, and I am fortunate enough, privileged enough to have space in the media. But I would like to remind all the other interviewees, these wonderful specialists, experts in economy, psychology, infectology, public health, politicians. I want to remind you that you are also old. It's like our president, who referred to older people as if it had nothing to do with him, and he is 65. This is one invitation that we have to do repeatedly. You know, listen, you are not only the expert, you are also an older person, and you have to interject this so that you can show empathy to people that are also your age. Second is to fight for space. Again, I am fortunate enough because I have had already and enjoyed a lot of media visibility, but now I'm fighting actively, proactively. You know, I'm ringing journalists and I'm reminding them, you are not giving the voice to all the people, as if it had nothing to do with us. Reminding them all the time, nothing for us without us. Is stop talking about what we do and what we not and what we need. And always reminding the message, and you know, Jane, because IFA and WHO closed ranks in 2006, and Luis was also part of that, and Help Age International and the UN. We commissioned 16 studies to look at older people in emergencies and crisis situations, from droughts to earthquakes, tsunamis, and wars. And in all cases, all the reports, remember, Luis, that older people were, yes, vulnerable. But above all, they were resilient and they were key for the reconstruction of their societies. Because they could see the light at the end of the tunnel. They could bring together a cohesive community. They could give hope. And it goes back, Jane, to the point that you made before. It is true in crises like we are living that this interconnection between generations, all the people finding their voices to calm, to bring hope, to see that there is a tomorrow, so that younger people will not go into despair. That is the role, but we have to fight for the space, because don't forget that the media also represent interests that are not looking at older people, that are incredibly ageist. I have seen one of the questions that pop up here, and I'm sorry that I cannot deal with all of them. Yes, corporations also have a very important role to play. And I unashamedly say that we cannot get out from this mess if we only rely on the wonderful work that needs to be strengthened from intergovernmental organizations, from civil society organizations. We need them, but we also need corporations to respond because they have the resources.
Yeah. So Alex, the final question is, as IFA, you know, how do we hold the feet of government to the fire on their pledges? You know, what would you be doing if you were sitting in my position or Justin's position or Peter Whitehouse's position? You know, just in a few words, how would you do it?
I would urge you, as I have tried to do yesterday with Justin, Help Age International and other non-governmental organizations, let us get together, because together we'll be much stronger. I'm delighted that you are having this series of town halls and opening up. And yesterday we had a teleconference with the World Economic Forum. That is what we need to really bring together so that our united voice will be stronger, and always insisting on the rights of all the people that they consider to be disposable. Women, indigenous, Black people, immigrants, disabled people. We need to bring all these voices together and not fragment them.
So is that your takeaway message to the audience today?
My takeaway message is that there will be a tomorrow. There will be hope. My takeaway is from the Yoruba culture in Africa. They have their stories, and one of them is that one of the young divinity, Yugunshan, is young and comes and breaks things. And then comes Yugulan, old, methodic, and very calmly will fix things. So I hope that this is the takeaway message. We will overcome this. It will be tough, but I continue to be hopeful.
And we are, Alex. So look, thank you. Let me just sort of put back to the audience some of the key areas that we talked about. You know, intergenerational solidarity, you know, the wisdom of older people, you know, the situation with healthcare systems that are absent in many and most low and middle income countries. You know, the importance of combating media and correcting false statements, the resilience and courage of older people, the devastation that could be occurring, but that is no different than it was 12 months ago, because we have not yet dealt in civil society together with other stakeholders, the dire inequity that's experienced in some, if not all, lower middle income countries. That's not to that's not to take away from the inequity in other countries in transition and those so-called rich countries. You know, but here we're talking about, you know, the vitality of community in low and middle income countries. You know, we also talked about the reconstruction of society, Alex, and, you know, that's what I heard, you know, that there is a tomorrow, and that only through partnerships and collaboration across sectors and across disciplines will it go forward. Mm-hmm. And I'm conscious of our discussion with World Economic Forum yesterday when I said, we're here to share unconditionally. Whatever you want, whatever you need, however you can partner with us or collaborate, you've got it. Because now is not the time to be territorial. You know, now is the time to break those down and be a clear force going forward, you know, to the development, the drafting, the resolution for a convention on the rights of older people. I'm also stuck in wrapping up that partnerships together, we are much stronger. We are strong, we are powerful, and that's the way that we can have conversations with government, because government will listen to 10 million organisations that have come together, or 1 million or 2 million. They will listen. They may not listen to one person, but they will listen to the power of civil society across sectors and across disciplines. You know, I'm delighted that I had the opportunity to listen to you again, you know, to moderate this important session, because at IFA, we strongly believe that the devotion to something is much bigger than ourselves. And there is space for kindness, and there is space for gratitude, and to reach out to every single one of us. One of the reasons that these town halls were established was because most of us are working remotely. And we're also experiencing the trauma and the experiences of seeing, reading, hearing the real-time tragedy. And also sometimes, you know, the joy of people. And so it's a real tension that I'm feeling every day. But I know that there is a way through, because just as a chain is only as strong as its weakest link, so the failure of a single country to contain COVID heightens the risk of the rest of the world. And so as we go forward, I thank you most sincerely and with love, Alex, for giving us your thoughts and the infectious way that you push out inspiration, commitment, and dedication to the field of older people and the rights of older people. I want to acknowledge everybody on the line, and also particularly IFA staff, and in particular Andra Stanku and Chesley Ryder, who single-handedly put these things together. So I'm grateful to you both and for the team of IFA. In closing, thank you, be safe and well, and keep an eye out for the next town hall. We've got a special town hall coming next Friday, and that is with the UN Office for the High Commission of Human Rights. So please keep that in your diary, 7 a.m. the same time. We will gather all of the Zoom group chat and also push that out with the ideas. We'll take your names out, but we'll have the ideas, because there's some great resources there. We welcome critical voices to what we're doing, and we welcome your collaboration and partnership. So be well. Thank you very much, Alex, and to all of you here. And we'll see you next time on Friday. Bye.